this man, he got some good news for you. Hey, man, listen. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house.
Oh, yeah.
The doctor is in the house.
Hey, ladies and gentlemen, the doctor is in the house. Welcome, everybody, to Dr. Ron, host of Dr. Ron, unfiltered, uncensored, bringing you news that you can use, definitely unapologetic, and we amplify the truth. And if
you want answers, I think I'm entitled. You want answers? I want the truth. You can't handle the truth.
If you can't handle the truth, this podcast is not for you. Welcome back, everybody. Today we'll be pulling back that curtain on something you don't want to face. It's our healthcare system. This is the third in a series. If you've missed the first two, please check out episode 627 and 628. This is 629, and we'll have a couple more after this one. So, just to remind you, without sunlight, you have no biophotons. Without sunlight, you have no photosynthesis, no nutrition, no vitamin D3, and consequently, no immune system. Diseases and disorders have been increasing exponentially since 1990. That is why I'm bringing you this series. We have an obesity epidemic, a diet and lifestyle epidemic. We eat highly processed foods, sedentary habits. We eat seed oils. They are environmental toxins. There is depression, anxiety, more prevalent than ever. We have a fragmented healthcare system where everyone has 4 or 5 or 6 different doctors, and none of them talk to one another, and none of them are really concerned with drug interactions. We have a paradox in this country. We have a high chronic disease rate. We have a low life expectancy rate despite massive healthcare spending. What a reflection that is of a systemic imbalance. And I wanted to start attacking this, but I couldn't do it in one episode. So we are doing it week by week. Remember, the U.S. leads developed nations in deaths from opioid overdoses, suicides, and alcohol-related conditions. Violence and accidents, we have higher rates of homicide and road fatalities, and they further reduce the average lifespan. The United States has one of the highest infant death rates among wealthy nations. We have healthcare inequality. We have chronic stress and pollution and economic insecurity that accelerate aging, and they accelerate the onset of diseases. 90% of the $4.9 trillion with a T annual healthcare dollars is spent on chronic disease and mental health conditions. It's not a great picture, ladies and gentlemen. That's why, as Hippocrates said, if you're not your own doctor, you are a fool. So let's get on with today's episode. Welcome back. So today I'm pulling this curtain further back on something most people really don't want to face, the system we call healthcare. But let's call it for what it really is. It's sickness care. You don't have healthcare insurance. You have sickness care insurance because it pays mainly when you're sick. It's a system designed to treat you once you're broken, not to keep you well. It's a system designed to maximize profits, not your health. It's a system that will sell you pills before it ever tells you to change your food. And unless you learn how to fight back, it's a system that owns you. It's a pill for an ill for life. And I'm not fear-mongering like Dr. Fauci would do. It's truth-telling. And today we're going to look at the medical education, pharmaceutical lobbying, hospital errors and infection, and most importantly, what you can do to protect yourself, because once you see the game, you can stop being a pawn. And I hope everything is recording because I don't want to have to do this again. So let's talk a little bit about medical education. Well, my take, it's built for pharmaceuticals. And it starts in medical school. Who funded the early 20th century Flexner Report that shaped modern medical training? Well, it was the Rockefeller and Carnegie Foundations, the same forces with heavy interest in oil-based pharmaceuticals. So what happened after that? Nutrition, herbal medicine, energy medicine, they were all pushed to the sidelines. Doctors graduate today knowing how to prescribe, not how to prevent. They're tested endlessly on drugs, not food and not lifestyle. And professors who dare to step out of line, many lose funding, many lose their positions altogether. So it is not education. I call it indoctrination. And it sets the stage for a lifetime of dependency on the system. They have you for life. Do you understand that? Okay, so that's one area. Medical education. Most of the hospital boards have a lot of pharmaceutical representatives on them. Just remember that. Second part, the lobbying these pharmaceutical companies do. Follow the money. You've heard that phrase before. Big Pharma spends billions with a B every year lobbying Congress. They write bills, they shape policy, they influence the very guidelines that your doctor follows. And we'll have a whole section on the American Medical Association and the American Academy of Family Practice and others. They are the middlemen. They protect the pharmaceutical interests instead of the patients. This is why prescription guidelines often favor newer, more expensive drugs, even when older generics or lifestyle interventions are safer and cheaper. This is why opioids flooded our country. This is why statins are handed out like candy, because of the cholesterol derangement syndrome. They don't get to the root cause of any diseases for which these highly cost drugs are used for. Your doctor isn't the bad guy, but they're trapped in a system that is bought and paid for. I hope, again, you understand that. I'm pausing here because I made some other notes and I can't find them. I'm sorry about that, but just give me a second. It is something that's been going on since 1910. 1910. The suppression of safe, effective alternatives, like vitamin D, like ozone, like ivermectin. Holistic healthcare, energy care, plant-based therapies. They're all branded as quackery. And remember, most people believe lies 100 times faster than they believe the truth. But these were all labeled quack, or the doctors that did them were put out of business. Then we come to the hospital errors and infections. We can call this the silent epidemic. We could call this a silent pandemic, because when we go inside the hospital, most people don't know this, but medical errors are the third leading cause of death in America, and hospital-acquired infections, well, they kill an estimated 100,000 people each and every year. Think about it. You go in for surgery, you go in for a broken bone or fracture, maybe you even go in for pneumonia, and you die not from the disease you went into the hospital with, but from what you catch while you're in the hospital itself. Where do these infections come from? Well, not just the obvious places. They come from what's around you, the bed rails, the curtains, the call buttons, the door handles, the tray tables, the equipment that is not properly disinfected. A recent ICU study showed that when cleaning protocols were enhanced, that is, more frequent wiping and targeting high-touch surfaces, bacterial contamination plummeted. But most hospitals do not do it consistently. And here's where you come in. As a patient, you need to take control. Ask the staff, when was this room last disinfected? Please don't be shy. Your life could depend on it. Wipe down the bed rails yourself. Wipe the remote controls. Wipe the tray tables. Use sanitizer after touching anything. Do not assume. Assist that the staff wash their hands and disinfect any equipment they put on you before it contacts you. Why am I telling you this? Why am I so upset? Because these small acts can literally save your life. Because when the system cuts corners, you must protect yourself. I hope you understand that. Well, here's a statistic from the CDC. They estimate of the 1.7 million hospital admissions per year, that led to that 99,000 plus deaths a year. And some I've even would round it up to 200,000 deaths a year. That's why it's so important. A few articles speculate a higher number, like 180, but it's a lot. If it's you, it's 100%. It's a lot of needless deaths in any case. But I can definitely defend 100,000 deaths a year. That's for sure. From poor cleaning, and it's preventable, reasonably preventable. Okay, hand cleaning, device management. So I'm sorry, I got to get myself calmed down. It's just unnecessary. So let's talk about a little unknown factor. Everybody said preventative care. Go get your testing. Go get this. Go get this. It'll save your life. Well, they'll tell you preventative care is the answer, but in today's system, even prevention has been monetized. Endless testing, endless screening, endless imaging, endless amounts of money being spent, all creating fear, all finding something which pulls you deeper into the system. And that something they find is then treated with the drug. Instead of empowering you, the patient, with proper nutrition and food, restorative sleep, movement, meditation, light, grounding, which are the foundations of health, they sell you fear and diagnostics. Prevention should mean giving you tools to stay healthy. Instead, it's just another profit center. I mean, this is something you have to pay attention to. You really have to pay attention to this. So keep if you're in the hospital, make sure you wash everything down. Be careful of preventative testing. And remember, all the normals in these tests are from sick people. They really don't know the normals of healthy people because they haven't collated it. When I was in medical school in the late 50s and early 60s, or just early 60s, blood pressure was 100 plus your age. Cholesterol was 100 plus your age. But as drugs became more and more innovative and old ones ran off patent and they needed new drugs, they kept lowering the numbers. It used to be 120 plus your age for a normal blood pressure. Now, God, it's probably down to 110 or something. And there's studies now coming out that too low blood pressure can harm your health also. You see where we're going with all this? Okay. So I have some question and answers I have here. Should I question my doctor? Absolutely, respectfully, yes. And ask, are there safer natural alternatives to this drug? Ask, what lifestyle or nutritional changes could I try first? Ask, do I need this test? Or is it just a routine? What's it going to show you? How's it going to change what you are recommending for me? And if you go into the hospital, bring wipes. Clean surfaces yourself. Ask about cleaning schedules. Insist on hand hygiene. You're not being rude. You're being alive. Another question I had is, how do I avoid being over-medicated? Well, what you can do, you or your advocate, keep a medication list. Ask, why this drug at this dose for this duration? Many hospital injuries come from properly prescribed medications. Don't assume they're safe, especially with the system in hospitals now with hospitalists. You may have a different one every 2 days. And I doubt that they talk to each other more than a few minutes. They just come in and say, hi, how are you? Are you doing good today? And that way they go. Yeah, you're going to have this test, that test, the other test. So what if your doctor says, I don't believe in natural options? Well, that tells you more about the system than about the truth. Seek a second opinion, ideally from a functional or integrative practitioner who looks at the whole picture. So this is a profit-driven system. It is sick care, it's not health care. Please remember that. The system rewards if a doctor orders procedures, prescriptions, and hospitalizations. You get no reward to keep people well and only coming to the office once a year. Chronic disease is profitable. Managing diabetes, managing heart disease, and autoimmune conditions generates recurring revenue. Curing or preventing them, not so much. The drug companies influence everything from research funding to medical education, often sidelining lifestyle and holistic interventions. And I can't talk enough about fragmented reactive care with no unified health strategy. Specialists treat symptoms in isolation. Few, if any, practitioners address root causes like inflammation, toxicity, trauma, be that mental or physical. And most care begins after disease has progressed, when it's harder and more costly to treat. And alternatives are suppressed. Holistic modalities are marginalized. Energy medicine, functional nutrition, spiritual healing are often dismissed despite growing evidence and demand. And as I said before, practitioners who challenge pharmaceutical orthodoxy or promote integrative approaches can face professional backlash. Doctors today are more for going for quick fixes. Sorry, I'm still getting used to my implants. Quick fixes over root healing. I'm sorry to say that most people are trained to seek pills, not a protocol of diet, exercise, and nutritional healing. And fear is the worst virus going around. Fear messaging. Disease is framed as inevitable, aging as a decline rather than as a process that we can influence. So we have a system that's failing, but there's opportunity to be educated, to get empowered, to reimagine your health. Okay, really important, ladies and gentlemen. So where do we go next? Well, today we pulled the curtain back on sickness care. Not as in-depth as I could go into, but I wanted to give you an overview. It's a system that's rigged by education, lobbying, errors, and monetization of prevention. But we're not done. In our next episode, I'm going to dig into medical errors even deeper, into the hundreds of thousands of injuries and deaths caused every year by properly prescribed medications, drugs taken exactly as directed, killing patients silently, and prescribed by physicians. So we'll expose cover-ups, failures, and real solutions. This is not just about surviving the system. It's about reclaiming your health, your freedom, and your future. And here I am, Dr. Ron, and I do not filter truth. I'm trying to amplify it. I hope you got something from this podcast today. And if you did, please share it. And please look for a streaming program that will be joining you within the next month of Dr. Jerry Smith and myself and guests, giving you news that you can use unfiltered and unabridged and unapologetic, talking about and there's no subject that's not that is not available to us. We'll be talking about vaccines. We'll be talking about that so-called safe pill. That safe pill, acetaminophen. Yeah, well, I'll tell you about that. 1,600 cases of acute liver failure each year because of acetaminophen. Guess what? Acetaminophen is the leading cause, responsible for roughly half of those acute liver failure deaths. Some 500 people die annually from overdosing on that drug. And we got people saying, well, I'm going to take 1,000 pills because Robert F. Kennedy says it could cause autism. Well, God bless you. in the next life. And it gets worse. And we're going to talk about it. I just have a note here. Recent research on acetaminophen users without prior kidney disease face a 31% increased risk of renal impairment compared to non-users. Does that seem like a safe drug to you? When the government agencies say something is safe, they're protecting corporate profits, not your health. They use phrases like safe when used as directed, while ignoring how easy it is to overdose, while ignoring the cumulative effect of these drugs, while ignoring the hidden acetaminophen and other medication, and ignoring the higher risk for seniors. And rarely, if ever, mention natural options or the need for monitoring if you have to use this drug or any drug for long-term use. So, ladies and gentlemen, this is Dr. Ron, host of Dr. Ron Unfiltered, Uncensored. The email where I can be reached is docronradio, that's DOCRONRADIO @gmail.com. If you have any comments, you can also leave comments on BitChute, Rumble, Spotify, Apple, any place that carries podcasts, I'm there. We are the 4th most listened to doctor podcast on the internet. And I do have an attitude of gratitude for that. And I want to keep bringing you news that you can use and news that you will not see in your newspaper or the Wall Street Journal or whatever other rag you read. You won't see it there because they are beholden to their advertisers. So if you can handle the truth, come back next week and check out Dr. Ron on X and True Social, and now back on Instagram. I'll keep you informed about the new series we'll have with Dr. Smith that'll be live and video. So thank you again. Freddie will take us home. Have a great day. Ciao.
Hey everybody, Dr. Ron's finished for today. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. And let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house. So if you have a pain, call the doctor. If you have a strain, call the doctor. Let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. See you next week.